Good morning. I present our study Predatory Leadership in Educational Organizations, an integrated model of personality, structure, and social dynamics. My name is Mónica San Juan Fernandez. Predatory leadership is a pathological and structural form of abuse. It damages teacher health, school climate, organizational justice, and the teaching-learning process. This phenomenon has been documented in Sweden, Norway, Germany, Australia, the USA, South Africa, and Spain. Study objectives. We have 5 objectives. First, to characterize the dimensions of predatory leadership. Second, to propose the 3 rings model as an explanatory framework. Third, to quantify the clinical consequences for teachers. Fourth, to evaluate the organizational and economic impact. And 5, to establish concrete proposals for prevention and elimination. Methodology. This is an integrative theoretical study based on 175 studies published between 2000 and 2025. We followed the PRISMA 2020 guidelines for systematic reviews. We searched Web of Science, Scopus, SciInfo, ERIC, and Google Scholar. Quality was assured with the MMAT 2018 tool with an average score of 82%. And the 3 rings model. We propose an integrated model called the 3 rings model. Ring 1 is personality, the dark ring traits. Ring 2 is structure, authoritarian and pathological bureaucracy. Ring 3 is social dynamics, the bipolarization between composite minority and isolated victims. Ring 1, the dark triad personality. The dark triad includes the 3 traits: narcissism, grandiosity, and need for admiration, Machiavellism, manipulation, cynicism, and selective use of rules, psychopathy, lack of empathy, impulsivity, and indifference to suffering. Leaders with high dark triad scores are 3.2 times more likely to be perceived as abusive. Ring 2, structure. The second ring refers to organizational structure. High-hacked authoritarian leaderships combined with pathological bureaucracy enables control and impunity. This structure makes it very difficult to report abuse. Ring 3, bipolarizing the social dynamic. The third ring describes the social dynamic. On one pole, the complicit minority, active accomplices seeking abatements, and passive accomplices aligned by fear. On the other pole, isolated victims who are labeled as problematic, stigmatized, and silenced by fear and retaliation. Clinical consequences. The health impact on teacher is severe. Irritable bowel syndrome, chronic insomnia affects 70% of victims. HPA-axis dysfunction appears in 67%, and cardiovascular risk increases with a relative risk of 1.49. Organizational consequences and costs. At the organizational level in Finland, an 18% annual increase in burnout. In Germany, 32% decrease in teacher self-efficacy, across 48 countries. Turnover is 2.8 times higher. And in Spain, burnout rose from 12% in 2016 to 47% in 2026. Organizational consequences and cost. The economic costs are enormous. In the European Union, psychosocial risks cost around 20 billion per year. In Denmark, absenteeism costs range from 1,900 to 3,900 per employee. In Spain, the cost is 8,000 per teacher per year, and turnover costs represent between 50% and 200% of the replaced workers' annual salary. In the Spanish context, Spanish studies confirm that lack of recognition and poor working conditions are the main predictors of burnout. Personal resources such as self-esteem and resilience act as the protective factors. Other organizational consequences and costs. During COVID-18 pandemic, the pool of prevalence burnout among teachers was 52% higher than among healthcare professionals. In the post-pandemic period in Spain, 76% of university teachers saw high burnout, especially 72% report high emotional exhaustions, 81% high depressed personalization, and 78% low personal accomplishment. But why predators persist? Well, first, they achieve short-term results which can blind superiors. Second, they build a complicity network that sustains their power. Third, complaint channels are fragile. Formal complaints often lead back to the predator. Paradoxically, they are perceived as effective by metrics that ignore human cost. Well, what about prevention and elimination? There are 4-level approach. Let's have a look. We propose the 3 levels of prevention plus structural measures. Primary prevention that tries screening in selection processes and mandatory rotation every 6 to 8 years. Secondary prevention, semi-annual climate audits, early warning systems, and 360 degrees evaluation that include teacher input. Tertiary prevention, anonymous reporting challenge with protection, rapid investigation within 30 days, and restorative justice program. Structural measures includes reform productivity indicators, establish dismissal mechanism, and implement health surveillance. Conclusions. There are 3 key conclusions. First, structural configuration actively enable abuse. Removing the toxic leader is not enough. Structural reform is essential. Second, the clinical impact. Insomnia in 73%, HPA dysfunction in 67%, and a 49% increase in cardiovascular risks. Positions predatory leadership as first or the social determinant of health. Third, the cost of 8,000 per teacher per year and 2.8 times higher turnover justify intervention on efficiency grounds alone. Organizational justice and teacher health demands an immediate institutional response. Predatory leadership is preventable, quantifiable, and solvable. What remains is political will to act. Thank you very much.